Hi, everyone. Welcome to the information session for the 2023 intake for the Master of Public Health program. Can you hear me? If you can't hear me, please let us know. And so thank you for taking the time to meet with us today. And I'm Dr. Wendy Lam, and currently the Academic Program Director for the MPH Studies. And with me today, we have Dr. Polly Wong, and she's the Deputy Director of the MPH program. And also with me today, we have Stephen Ip, and he's our MPH office administrator. And so we will be here to share the information regarding the MPH program with you. And also after the presentation, we will have the Q&A session. So if you have any questions, you can put it at the Q&A box. Okay. Okay, so in the presentation, it will be a very brief presentation because what we're hoping is to give more time to allow the attendees to ask questions, so we will be able to clarify some of your concern with you. So what we're going to cover tonight in the presentation is to go through some of the key features of the Hong Kong U MPH program, and we will also talk about the importance of the CEPH accreditation, which Hong Kong, our MPH program is accredited CEPH program. And also we will share with you the current student profile that in our current intake, and also our curriculum, and also some of the details related to admission and scholarship and fellowships. So why you're interested in Master of Public Health degree? And many of the public health jobs benefit from graduate with MPH degree, and it is one of the most widely recognized professional degree in public health. And our graduate gain a competitive edge in terms of we provide broad practical knowledge and also skills needed to be effective in practice in the field of public health. And why choosing Hong Kong U? And Hong Kong U is one of the top universities in the region. For instance, the recent QS World University Ranking, we are ranked first in Hong Kong, 5th in Asia, and 21st in the world. And in terms of the faculty of medicine at Hong Kong U, we rank first in Hong Kong, second in Asia, and also the 13th in the world, according to the World University Ranking this year. And also, our program is the first and only CEPH accredited program in the region. And also, our MPH program is recognized by the Hong Kong Medical Council. So it is a quotable qualification, and also participant will be accredited for a CME and CBT point if appropriate. And here are some of the feedback from our previous graduate who shared their feedback regarding our program. And I did mention CEPH accreditation. So what is it? So as I mentioned earlier on, our program is the first in the region and the only academic program in Hong Kong fully accredited by CEPH, which is in the full form is the USA Council on Education for Public Health, which is the longest standing accredited body of public health school and program in the world. And why it is so important? Because CEPH accreditation is considered as the benchmark of quality in the evaluation of public health program, and a CEPH accredited degree program has completed a multi-levels review and has to be found to meet the nationally agreed upon standard developed by the public health academics and practitioners. And what is the benefit of getting a degree from a CEPH accredited program? Attendance at the self-accredited program provide a pathway to be eligible to sit for the Certified in Public Health exam and obtain the CEPH credential. And this is important because some of the employment is only open to graduate of CEPH accredited units, and also some of the fellowships that are available only for those students who have attending the CEPH accredited school and program to be eligible to apply for. Now we show you some of the student profile in our program. So this is the number of intakes that you can see from 2018 to the current cohort. As you can see, the number of intakes has been increased since 2018. And in our current cohort, we have admitted over 178 students. And in terms of the background, so as you can see, we have a diverse background of in terms of our student cohort. For example, we have our current cohort, we have physicians, dentists. We also have other healthcare professionals, including nurses, physiotherapists, pharmacists, etc. And also other students with other healthcare and related occupation. For example, some of them working in administrative field, social service, education, etc. We also have researchers who are coming back to study MPH with us, and also we also have fresh graduates who just complete the undergraduate training, and then they join us right after they finished undergraduate study. And we also have some of the MBBS medical students who are taking a gap year and to join us to study MPH with us. So we actually have a diverse background of students, which is important because it's enables students to actually engage with others with different background that enhance have a broader perspective in terms of looking at the subjects. And so here are some of the academic background of our current students cohort. So as you can see, some of them have a health professional degree. For example, they had a B nursing degree, Bachelor of Nursing, and some have a Bachelor of Medicine, specialized in preventive medicine. Also, some of them graduate with a Bachelor of Science. We also have students who don't have the healthcare background. For example, we have a student who had a Bachelor of Engineering degree or Bachelor of Arts. They decided to come in and join us as well. And in terms of the career prospect, so many of our graduates work in the diverse sectors. For example, we have 40% of our graduates working in NGO or social and public organization, including locally hospital authorities, Mother's Choice, the Hong Kong Society for Rehabilitation, etc. And also we have a sizable of our graduates working with the government, the Department of Health, Center for Health Protection, and also some of our graduates are from mainland China, and they go back and they work for the CDC, etc. We also have student graduates who eventually decided to work in the educational institution, for example, Hong Kong U, and also other local educational institutions as well. And in terms of the career prospect, as you can see the breakdown of the pie chart, so about almost half of them work in the medical and health service field, but we also have a sizable of the graduate, they pursue a scientific or research work after they finish the MPH study, and some of them continue to work or they join the administration management field. And also we have some graduate who work in the information technology field as well. So now let's look at the curriculum. So for the MPH program, this is the outline of our curriculum. So it's divided into courses and also practicum and capstone. As you can see, for each of the students who being admitted to the MPH program, you have to take 6 core courses and 6 concentration courses and 2 elective courses. And that in total will you will get 42 course credits. And in addition to that, in order to fulfill the requirement for graduation, you also have to complete the practicum and also capstone project as well. So that in total, you need to actually achieve 69 credit in order to fulfill, to graduate from our program. And for the MPH program, you can choose between 1 year full-time or 2 years part-time. And also, as I mentioned earlier on, we have some students who are currently studying our health professional degree, for example, MBBS, Bachelor of Nursing, Bachelor of Pharmacy. So they are taking a 1 year out of the program, and so the integrated program, we only offer 1 year full-time. So here are the 6 core courses that all students who are admitted to the MPH program, you must take these 6 courses. The objective is these 6 courses will cover all the foundational competency that you must achieve when you graduate from our program. And this is part of the CEPH accreditations as well. And these 6 courses, including you will learn about the foundation knowledge of biostatistics, epidemiology, and also the principles of public health. And you will also learn about the foundation knowledge related to health behavior and communications theories in relation to health leadership and management, and also health policy and politics. And in addition to the 6 core courses, you will also have to complete the concentration courses. So we have 4 different concentration courses, and I will go through one by one. So the first one is epidemiology and biostatistics. And for this particular concentration, our concentration lead is Professor Ben Cowling. And in this particular concentration, we focus to provide comprehensive training in epidemiology and statistics, including learning skills, how to collect data, how to manage and analyze and interpret medical and health research data. And here are the learning outcomes. Because of the time, I won't go into details, but as you can see, the focus is to enable students to learn how to project trends in major causes of morbidity and mortality for public health surveillance, etc. And for control of infection diseases, which is another concentration program. So for this particular concentration, our concentration lead is Professor Leo Poon. And in this particular concentration, we focus to look at how we can take advantage of recent methodological development in various areas, including epidemiology, statistics, outbreak management, mathematical modeling, microbiology, vaccinology, and risk communication, and look at how we can tackle infection disease. And in this particular concentration, we provide knowledge and skills necessary to understand the relationship between the key variable associated with pathology, transmission, and control of infection diseases. And the learning outcome is to synthesize, you learn how to synthesize data to describe infection disease in various areas, to describe the scientific and underpinning pinning of common infection disease that impact population health. Also, you learn about how to interpret simple analytic models of infection disease transmission and control, and also how to analyze factors that contributing to the emergence of novel infection disease. And also we talk about the concept of One Health. And lastly, in this particular concentration, you will also learn how to evaluate the strategies for infection disease prevention, control, and risk communication. So the third concentration is the health economic policy and management. And for this particular concentration, our concentration lead is Dr. Chao Kwan. And in this concentration, students will examine economic, political, leadership, and management principle to apply to health system, and healthcare. You also learn about economic evaluation of health policy, program, and intervention. Also, you will have an opportunity to examine healthcare system resource requirement, and also some of the core competency of healthcare leaders and managers. So here are the learning outcomes. So in this particular concentration, you will be able to, by the time you finish the complete this concentration, you should be able to assess the economic impact of decision-making on various levels, assess the impact of financial and payment incentive on individuals and organizations. You should be able to demonstrate how to use economic or financial analysis to understand the supply and demand for healthcare and healthcare resources, how to apply models of rational choice and decision-making under condition of uncertainty to markets. Also analyze the impact of human, social, and economic dynamics on organizational behavior. Also able to demonstrate ability to appraise the impact of leaderships and governance on the financing of public health system, and also cost of health service delivery, and how to appraise the influence of political institution and process on resource allocations in healthcare sector. So the last concentration is public health practice. And this concentration is led by Dr. Dennis Yip and myself. And in this particular concentration, we prepare students to become the effective practitioner of public health through learning how to analyze contemporary global health issues. And we focus on social determinant of health, and also environmental health and personalized public health. So when you graduate, you should be able to learn how to use systematic approach to solve public health problem, and how to apply theories in risk perception and decision-making to improve risk communication. So the learning outcome include being able to adopt an ecological system perspective in analyzing global health issues, to synthesize how major social determinants shape intervention in order to improve population health, synthesize the potential contribution and implication of personalized public health, and also you should be able to demonstrate how to apply theories in risk perception and decision-making to improve risk communication, and formulate evidence-based strategies to address environmental health issues, and also demonstrate the use of systematic approach in solving public health problems. So here are the list of concentration courses you must take if you choose a particular concentration. For example, public health practice, the concentration courses include you must take environmental health hazard and intervention, health and society, human health future in a globalized world, personalized public health, risk perception, decision and communication, and the practice of public health. So all these concentration courses will prepare you to achieve the learning outcome that we have listed out in our concentration for each of the concentration. So I won't go into details, but you will be able to actually access this information on our website. In addition to the 6 core courses plus the 6 concentration courses, each of the students who enroll into the MPH program also needs to take 2 elective courses, and the elective courses can be any other concentration courses that are not compulsory for you to take. Plus, also we have other elective courses that you can choose from. Some of them are listed here. For example, comparing system of elder care, infection disease modeling, and also we have in partner with Center for Medical Ethics and Law. They also offer some of the elective for our students to take as well. And in addition to the 14 courses that you must complete, we also have each of the students required to complete the practicum as well. So the practicum aims to prepare students with a broad mastery of subjects. So basically you learn the theories, the concept in the class, and then the practicums enable you to apply what you have learned in class in a real life setting. So that's really the goal of the practicums, to give you the opportunity to actually apply what you have learned in the classroom in a real world. So here are some of the examples in terms of the practicum site who have been in partner with us offering practicum to our students. So for example, Pathfinders, the Fu Hong Society, and also Mother's Choice. So these are just some of the examples that they offer practicum to our students, and these include many of these practicum sites are the non-government organization, but also there's others private corporate sectors in the health field. They also offer practicum to our students as well. And also each of our students must complete the capstone project. And the capstone project is basically a accumulating experience that will enable students to integrate and synthesize all the competency they learn in class specific to the concentration of study. And each student must complete a capstone project on a topic that approved by the capstone advisor. So each of the students who are admitted to our program, you will be assigned to work with one of our academic staff who will be your capstone advisor, and working with the advisor, and you will produce a 5,000 to 6,000 word capstone project at the end of the study. And it has to be a high quality written product that the idea is any external stakeholders, for example, NGO, when they read your report, they will be able to actually apply what you recommend into the real setting. So this is a scheduling for our program. So we offered mainly weekdays evening courses, which start at 6:30, usually to either 8:30 or to 9:30, and usually once a week. And also we offer weekend morning courses as well. So some of the courses are offered on Saturday morning. We also have some intensive course, which will actually run in 2 weeks in order to complete the course. The venue, all the classes are held at Hong Kong U Medical Campus on Southend Road, Port Phillip. And the format of teaching is face-to-face. So we expect a student who join our program, they have to attend classes in person, face-to-face. And we do require minimum attendance for each course, which is 80%. And you can find out more details on our website for the timetable. Now we look at the admission. So here are the important dates that you want to pay attention to. So what we have done is we separate the local applicants versus the non-local applicants. So the deadline, some of the dates are slightly different. And as you probably aware that our application opens started in 1st of November last year. And the application deadline for early decision is approaching, which is the February 15. And for the local applicant especially, you want to pay attention to the date, because if you are planning to apply for the UGC TPG program fellowships, you must submit your application no later than the 28th of February. So this is an important deadline if you are local applicants who are thinking about applying for the fellowship. And the application deadline for main round and also for the local applicants is April 28th. So that's the deadline. And also for those who are interested to apply for the TPG program fellowship, so if you do get the offer, then you must accept the offer but no later than the 28th of April in order to be able to and apply for the fellowship application as well. And we also have the clearing rank, which is the deadline is the June 30th, which is for the local student and also for the MPH intercalated program. But we don't have a clearing rank deadline for the non-local applicants. The main reason is because it takes much longer for the non-local applicants to process, because you have to get the student visa in order to be able to come to Hong Kong to study. So that's why we have to have an early deadline for the non-local applicants. And in terms of the process, and usually we conduct the admission interview for any applicants that we being shortlisted, and so you'll be interviewed by the concentration lead. And also the recommendation will be reviewed by the MPH Board of Study and the faculty and the registry. And so admission decisions are made on a rolling basis. So the earlier you apply, the sooner you will actually hear from us. And this is the online application website. So please go onto the website and you will find out the details. So this is where you have to submit have to process your application. And make sure that you pick the right program. So as you can see, we have you will find 4 options for the MPH program. It's very much depending on which concentration that you're interested in, and then you make sure that you pick the right one. And also you can specify, you need to specify whether you are you're interested to apply for full-time or the part-time studies. And also for the required document, you must submit the online application form with the transcript. And for those who require the English test, you must provide the document as well. And also you need to provide the online verification report for the higher education qualification certificate if applicable, for those who require to share that with us. Also, you may want to look for the academic reference report, and optional, you also can provide your CV and also other supporting document that you think it may help to, for your admission application. And this is just to remind you, so this is where you need to submit all your supporting documents. So it's important to check that you actually submit all the required documents, because even though you may have shortlisted and you've gone through the interview, but if you have not actually provide all the necessary document, it may delay your offer. And this is the fees, the provisional cost fee for the coming year. So it will be 200,000. So for the part-time student, then it will be 100,000 per year. So for intercalated students, the fees will be specially arranged with the faculty. So we also have scholarship and fellowship to help some of the students who need financial needs. For instance, we have recently we have a donation that will offer 2 scholarships for young healthcare professionals from low middle income countries who would like to pursue the public health study at Hong Kong U with us. So for this particular scholarship, and we will waive the composition fees, and also the student, the awardees will receive the stipend to support 1 year's living expenses while they're in Hong Kong, and also will cover the economic class return airfare from your home country to Hong Kong. And also you will have 1 year free accommodation at the university student residence. And the awards are on the basis of the academic merit and also the community service that you have done before. And the application deadline is April 28th. So basically, this scholarship will cover all the expenses for those students who are being awarded with the scholarship when they come and study with us. And in collaboration with the International Psycho-Oncology Society, in 2021, our board of study of MPH have established an entrance scholarship for psycho-oncologists who is interested to pursue a public health study with the aims to optimize cancer care, especially on psychosocial cancer care provision. And so we will offer 1 scholarship per year, and it pursue it either full-time or part-time depending on the basis of, and the decision is on the basis of the academic merit, contribution to community service, and financial needs. And also the candidate must demonstrate a track record of accomplishment in the psycho-oncology field through membership in and also affiliate with the reputable professional bodies. And the scholarship will basically cover the tuition fees. So the application deadline is the April 28th this year. We also have other 2 scholarships, the honorary teacher scholarship and the Professor Anthony Hadley scholarship. And these are the scholarships that will open for all students who have admitted to our program, and it will be awarded on the basis of academic merit, and also will take into account of the achievement in community service, for instance. And for Professor Hadley scholarship, the priority is given to students with the interest in environmental health. And the application deadline is the August 31st. And so I mentioned that we have the UGC TPG Fellowship, and this is the government initiative. The aim is to attract local students to pursue interdisciplinary and in-depth postgraduate training in priority areas of strategic importance to Hong Kong. And Hong Kong, our MPH program, this is the 4th consecutive years that we've been selected to be part of the fellowship scheme. And we have a total of 30 places that we will be able to offer to the candidates, and each of them will receive an award of 120,000 to cover the tuition fees. So who will be eligible to apply? And this fellowship open to local students only. So it can be both full-time or part-time students who are local students, and they have to admit it to the program. And so anyone who have offer have the offer from us, and when you must accept the admission offer plus pay the deposit no later by April 28th this year. And also you must submit a proposal stating your commitment and the plan how to contribute to promote good health after completing the program. And in terms of the assessment for the fellowship, we look at academic achievement, we look at the professional qualification, also the relevant working experience and achievement in other areas. And also we take very seriously in terms of the quality of the proposal as well. So the procedures to apply for the fellowship is you must submit your application for admission to the MPH program and upload all the required documents and no later than the 28th of February. So this is an important date if you are interested to apply for this fellowship. And all the admission application will be reviewed by the MPH selection committee and also the faculty and the university. And usually it takes about 4 to 6 weeks. And once you accept, and once you receive the offer from us, you must accept the admission offer plus paying the deposit and submit the separate application for the fellowship by 28th of April. So you must submit a separate application. So the application for the admission, it doesn't immediately give you the eligibility to apply for the or to become eligible for the fellowship fellowship program. So you must actually submit a separate application. So we will remind you if you're eligible and you receive our offer. So if you want more information, you can go to our website, and which will give you more details information regarding the program. And also our social media platform. And here are our contacts. So you can contact the MPH office or myself or Polly. And so you can actually contact us, either of us. And thank you very much for your attention. And now we go to Q&A.
Okay. So for those questions that were more individualized, Stephen and I have been answering them questions, and all attendees can also see our answers. But we've answered more individual questions for you, and we've left the questions that are more broader as a Q&A, so everyone can know. So we have 2 questions about interview process. They would like to know about the format of the interview, and they would like to know how the format, what interview would be like. So if students so once you've submitted all your application, we will review it, and shortlisted students will be invited for interviews. The interview would be in a Zoom format, and usually we would ask you about your interest in the program, who you are as a student, why are you interested in public health, what do you plan to do with the MPH, and basically we want to know more about you to see if you're a good fit to the program. So that's the answer for our question for the interview process. And then we have a question about if you can change concentration afterwards. So when you apply to the MPH for your application, you do have to select a concentration first. But once you are admitted, you are allowed to change concentration once. So if you feel that you are more fitted to a different concentration after you have enrolled, there is an opportunity to apply to change concentration.
And also sometimes when we review your application and because we look at your background and your experience, and if we think that another concentration is more suitable for you, we sometimes will actually recommend you to consider to apply for other concentration than the one that you chose from, because based on our experience, sometimes we will be able to guide students to actually choose a more relevant concentration.
Another student has asked if they have to submit an IELTS report with your application. So if your university or your graduate university is a non-English speaking university, you do have to submit the IELTS report. You can find more information about your supporting documents required in our MPH website. So please visit that. In terms of teaching hours, they would like to know the teaching hours and how long it requires to complete a course. So our teaching hours are usually in the evenings, in the 6:30 to about 9 to 9:30. And we also have sometimes weekend. This was mentioned earlier in the slides. And usually they are at evening classes. And in terms of how many hours, it's usually about 30 to 32 teaching hours. But we will require, at least if you're own self-studying, we expect every one teaching hour to at least to have 2 to 3 hours of self-learning. So this is more of your consideration of how much commitment is required for MPH degree. I got a question about how long is the practicum. So the practicum is part of your MPH degree, and it is a minimum of 200 work hours. You will be allowed to either choose organizations that we provide for you to take on different placements, or you can also initiate practicums at your own workplace or other organizations outside of your workplace. So there are flexibility and options for you to apply. So we also got some questions about local students. So if you are not sure whether you are considered a local or non-local student, local students in Hong Kong means that you have a Hong Kong ID with permanent resident status. If you're not sure, you may need to check with immigration just to see if you're required study visa for Hong Kong. So you need to, this is a very personal question. Is there flexibility on arriving to lectures after work? So our lectures are face-to-face, and flexibility. We do require, we do hope students arrive punctual, because this is a respect to both the course coordinators and also the teachers and the tutors. But usually our classes start about 6:30 in the evenings. What is the minimum score of IELTS? You can also double check the university minimum standard. That is the HKU requirement, but we also have an in-house consideration, because we do receive applications from a lot of students. So we do want students to make sure that they are of English speaking capacity, because we are English speaking university. How many students are accepted? So we have some questions about intake. So this varies every year. For your reference, in 2022 to 23, we have accepted about 178 applicants. But this will vary year to year. So we will review every year.
And as we mentioned in the presentation, we have been receiving more and more applications, partly because of the COVID pandemic. More and more students are paying attention or being interested in the field of public health and decided to pursue a postgraduate degree in public health. So we expect to receiving more application per year, and considering the sizable number of applications, we may expand our student population accordingly. But another point is that we are reviewing applications on a rolling basis. So those who submit the application earlier will be reviewed in the earlier stage of the whole admission cycle, and they will be have a more competitive edge in comparing to other candidates who apply in the later stage.
So I have two questions about the practicum, so I will have to answer that. So a student wants to know more about what kind of opportunities we have for practicum for students to apply. So we do have a list of school-approved practicum organizations that are either within Hong Kong or outside of Hong Kong. They are usually local NGOs or nonprofit organizations or consulting companies or pharmaceutical companies, and it really varies. And we do have a list of available organizations. And basically these organizations take our students, and then they are allowed to do a practicum, whether that is a project or a health needs assessment or some kind of research related, but has to be public health in the field, and students are able to complete a practicum. And I have a student asking about whether it's possible to do a practicum at your own workplace, especially if you work in HA. We do have students that are working in HA, whether in a capacity of a clinician or a nurse or other roles in the HA, and they are able to complete their practicum at the workplace, given that they're able to apply the practicum requirements in a public health setting, because sometimes it depends on what you do at your workplace. You need to be applying public health because you are in an MPH degree, but this is possible and many students in the past have done so. You can also, if you want more information about what kind of students did in practicum, you can also visit our website, and there's a section on practicum which we ask students to give their experience, share videos, talk about their experience. So please visit our website for practicum related questions, or you can also email me and I'll be happy to answer your question.
And there's a question asking if I graduated from a university in mainland China, but it is a completely international medical school program, and the degree is taught completely in English. Do you still need to submit any proof of your English proficiency? In that case, your home institution or the university need to provide you with a proof or a letter of certification stating that the language of teaching and learning is in English. Then it will help you. Then it will fulfill the English requirement by the university.
We also have a question about the our CEPH program and what the benefits are. So yes, our MPH degree program is CEPH accredited, and the benefits of being in a CEPH accredited degree is that you are eligible to take different examinations, including the certified in public health, which is a US-based examinations. Again, if you want more information about what's the difference between a CEPH accredited degree and a non-CEPH accredited degree, please visit our website, which we can tell you more information, or you can contact us for more details. So we have a question about concentration and worry that maybe they have, it will influence their application. We do really want you to consider your interest in public health, and that's why we want you to choose your concentration. But again, if you think that you have applied for one concentration and you come into our program, you want to change, there is a possibility to change. But it would be good for you to at least pick up one of the 4 concentrations you're interested in. So then you can actually tell us why you're interested in public health. About the UGC postgraduate program fellowship scheme for the proposal, there is a format for proposal. So there is a application form, and usually the format of the proposal tells us about who you are, your experience, and also giving us a proposal about what you plan to do after MPH degree, why you're interested in public health. So really the proposal is about what are you doing with this MPH degree that will help benefit Hong Kong or benefit yourself personally or as a public health community. If I want to, so if a consulting company, so an MPH degree and an MBA degree is very different. So you do need to consider what kind of career or what kind of competencies or what kind of courses you would like to take that would benefit your own career. So it's difficult for us to answer which is better, but because people that work in healthcare and consultant have a both degrees. So this is a very personal question. You may need to review what is appropriate to you. For you. Is your cap limited places for each concentration? So far, we have not set a limit or a cap. So basically, you should be applying for concentrations that you're truly interested in. Can you choose? So for the capstone, you will be assigned a capstone mentor, and usually we try to, as much as possible, assign a capstone advisor that is being able to help you to support your capstone or your interest in concentration. So you are assigned a capstone advisor. Yes. So if you have obtained your bachelor's degree in HKU, because HKU is an English-speaking degree, you do not have to do IELTS, but you do need to submit your transcript and all other certification requirements for us, for your application. So we will keep checking the Q&A. So if we have missed your questions or you want further clarifications, please use the Q&A function and we will try to answer our questions as much as possible. So Kathleen, you've asked about how long will we get because we accept applications on a rolling basis. So we do need time to review your applications and to shortlist students. So we really encourage students to apply as early as possible and definitely before the deadline. And we will try to get back to you as soon as possible and let you know the decision in terms of interview and also whether you're offered the degree.
And also your admission application will only be reviewed after we have received all the required supporting documents from you. And usually after we have received those documents, your application will be reviewed in a few weeks.
And if you do get be invited to actually come for the interview, and usually after the interview, it will take about 2 to 3 weeks. Then we will send an email to let you know the decision. And then, but that's only just notification that we are recommending to offer you a place. But for the formal acceptance admission offer, you have to wait for the university to send out the letter, which usually takes longer to do that.
So we have a question about shortlisting students. I think that's the main question. So again, applications will be reviewed on individual basis, and we select students that we think that are suitable and eligible, and then actually have keen interest, and then we would invite them for a Zoom interview. Okay, so for the CPH, someone has asked about CPH examination. We actually have recently completed a webinar with the CEPH representative, and we will be uploading this video on our website. And in the video, the CEPH representative was able to tell us about the eligibility, the path, and like what is the requirements and logistics. So please stay tuned in our website, which we'll be posting it for all students to see. So maybe check again on our website by next week. Or sorry, maybe after Chinese New Year. Okay, so we have a question about looking more about career choices for MPH and getting a degree. We really see the MPH degree as a degree that opens a lot of pathway. So this is a professional degree that allows you to apply for different or be eligible or be applicable for different career paths. So unlike let's say a clinical degree, it's not that you are a certain profession because of this degree. Rather, the MPH degree opens a lot other doors. So we have students that are enrolled in either academia or university research or NGO activities, or they do consulting, or they work for the government. So really the career path and the career choices are unlimited in our chats.
And we often provide advice to students in terms of the career path once you join the program. So we often have students who approach us after during the study, and when they want to actually think about in the futures after they finish the MPH study. So so we are here to provide more support and guidance once you enroll into the program, because I think once you enroll to the program and you have better understanding of what public health is about, usually that's often the time students will start to come and ask us for advice in terms of the career choice in the future.
So yes, if you are shortlisted for interview, and interview process is a must, all accepted students or offered students will have an interview that will be conducted.
And there's a question asked, does the department give conditional or unconditional offers normally And normally the offers that we give out to candidates are conditional offer, because most candidates will submit copies of their certificates or transcript to us for admission review. And we will, based on the copies of documents that received, and then review the application and give out the conditional offer. And students have to submit the original copies or certified true copy of those supporting document before the start of the program, in order to fulfill the conditions and get the firm offer. But if at the very early stage of the application, you have already submitted the original or true copy to us, then we would be able to give you a straight unconditional offers. It really depends on what kind of document that you gave us.
So if we have missed any other questions, or if you have any questions, please do use the Q&A. How will attendance? For attendance, we usually use an in-house QR code. So we ask students to scan or either to take attendance by the card. So this varies. Depends on what lecture style. But yes, attendance is mandatory, and minimum 80% attendance is required for our courses. So for class size, it depends on if it's a core course or a concentration course. Core courses, because all students have to take, are a bit bigger, usually about 150 plus. And for concentration courses, because it's much smaller capacity, courses are much smaller scale, depending on what concentration you are. But we are sure that all class sizes are well supported by tutors, and we try to maintain a good teaching to staff ratio for every of our class.
And often for the bigger classes, we provide tutorial that will enable students to actually work in a small groups. So then there are many opportunities for students to interact with each other, as well as with the teachers and the tutors as well.
So we see the question again about the teaching hours. So we have showed the class arrangements. Please note that part-time students and full-time students take the same courses. So there's no part-time course or full-time course. I think that was what the question is. So again, the teaching hours are usually on weekdays and evenings, and also weekend morning, and there are intensive classes sometimes in a curriculum.
But for part-time student, because you will be spread out your study for through 2 years instead of 1 year, so it will enable you to actually spread out your study. So usually student will take about half of the studies, half of the courses in 1 year, and then the remaining courses in the second year.
We have a question about cutoff and signing attendance. Again, we really do encourage students to be as possible, be on time, particularly because if there's tutorials or if there's presentations, you might be missing some of the materials, but really we understand that students have to travel into work. So as long as you make an effort to make it, but I try to be punctual as much as possible. In terms of popular concentration, this depends, but we really think that rather than knowing the more popular concentration, you should be applying for a concentration that you're truly interested in studying. So if you're interested in epidemiology statistics, you should choose concentration rather than choosing the more popular concentration. What are you looking into in MPH? What would you like to do? I think that's more of a better question.
And also think about your career plan as well. So what is your goal in terms of, where do you want to go after you finish your MPH studies? And that will also influence, which choice of concentration will be better for you.
Internship. So in terms of internship opportunities, this is basically what the practicum is. So a practicum is basically an internship where you're applying your MPH competencies in a different organization. So that's the definition of internship. Part of the MPH program requires an internship to be completed. So we will be around for a couple of minutes, but as we reach towards the end of the info session, we do want to thank everyone for attending and joining us this evening. If you have any further questions or something that we have missed, please continue to use the Q&A. We will be here to continue to answer questions. But otherwise, we want to thank you for your time for joining us, and we wish everyone a lovely week and also a happy Chinese New Year. So we have a question about intercalated degree, which is you're part of our HKU and you're looking for intercalation into our MPH. This does vary every year to year. And it also depends on what program you are, whether you're an MBBS or nursing or a Chinese med pharmaceutical. But again, we think that if you are genuinely interested in MPH degree, please do apply and submit your application as you wish. So we will leave our contact information on the last page. Okay, we have a very individual personalized degree question, but I think this is more on the matter of whether you're able to submit your certification before acceptance. This is why there's a conditional offer. So it really depends on when your university or your bachelor degree or whatever degree you have issue your certification that you have completed the degree. Because for our MPH, you do need at least a bachelor degree. So you do need at least to complete your graduation or certificate, or at least your university is able to provide documents that you have completed all the requirements and you will be graduating. This is just a verification process. So you really do need to see whether you are able to provide the proof for your certification. So then we can give you either a conditional offer or a confirmed offer, depending on your status. Okay, so we don't see any more live Q&A questions. So again, we want to thank everyone for your time for joining us, and we wish everyone a lovely evening. We will end our webinar and info session here. Thank you.
Thank you for your time.